The pelvic bone, or os coxae, is made up of three parts: the ilium, ischium, and pubis, which bear the weight of the entire upper body. The weight is then transferred from the axial skeleton to the inferior appendicular skeleton when standing, walking, or running. The pelvic bone also protects the organs of the abdominopelvic cavity and anchors the powerful bones of the hip, thigh, and abdomen. Many muscles, such as the adductors and hamstrings, attach onto the structures of the ischium. The ischium forms the posterior inferior portion of the hip bone. The ischium is very important in sitting because it bears all of the weight. There are many unique structures of the ischium, including the body, the ramus, the ischial spine, the lesser sciatic notch, the ischial tuberosity, and part of the acetabulum. So here I'm holding a left os coxae, and the ischium forms the posterior inferior region of the hip bone. It's shaped like an arc and has a thick superior body and a thin inferior ramus. The ischial spine lies posterior to the acetabulum, which is right there, and it projects medially. And inferior to the ischial spine is the lesser sciatic notch. The ischial tuberosity is the inferior surface of the ischial body and is rough and thickened for muscle attachments and bears the weight of the body when seated. The ischial spine, a triangular-shaped structure, is an attachment point for a ligament on the lateral side of the sacrum and coccyx known as the sacrospinous ligament. The main function of the sacrospinous ligament is to prevent posterior rotation of the ilium with respect to the sacrum. The acetabulum is a cup-shaped cavity on the lateral side where the ilium, ischium, and pubis meet. The ball-shaped head of the femur articulates here, which forms the hip joint. The lesser sciatic notch is smooth and covered in cartilage. The lesser sciatic notch allows passage of the obturator internus tendon. Nerves and vessels pass through the lesser sciatic notch that serve the perineum, which is the area around the anus and external genitalia. The ischial tuberosity is the strongest part of the os coxa and bears all the weight when seated. A ligament that attaches onto the ischial tuberosity and the sacrum is known as the sacrotuberous ligament. The ligament is comprised of collagen fibers and is very strong. The sacrotuberous ligament prevents the sacrum from moving and provides support. An ischial tuberosity injury results from a forceful pull of the adductor and hamstring muscles and is caused as a result of trauma, such as a fall or through overuse. Ischial tuberosity injuries are common in jumpers or runners, such as soccer players, cyclists, baseball players, figure skaters, and cheerleaders. Ischial tuberosity pain is described as a pain in the butt. With this injury, it is very difficult to sit, run, or lift heavy objects. Ischiogluteal bursitis is tissue damage and inflammation to the ischiogluteal bursa. A bursa is a small sac filled with fluid that functions to reduce friction between tissues. The ischiogluteal bursa is located between the hamstring and the ischial tuberosity. The hamstrings are a highly active muscle during running and jumping, and when too much pressure and high force is applied, irritation and inflammation of the ischiogluteal bursa may occur. Pain in the lower buttocks is common and can be sensitive to the touch if symptoms get more severe. Physiotherapy treatment is important to ease the healing process and decrease the likelihood of reoccurrence of ischiogluteal bursitis. Soft tissue massages, stretches, electrotherapy, ice or heat treatment, and exercises to improve strength, flexibility, and core stability are key in reducing ischiogluteal bursitis. Prolotherapy is a non-surgical treatment of ligament and tendon reconstruction. Prolotherapy is a regenerative treatment that may successfully treat ischial tuberosity pain. Injections to the sacrotuberous ligament and the hamstring tendon attachment may stimulate repair of these damaged areas. The os coxae is a very crucial bone with many important functions. The ischium and the structures that make it up contribute to sitting down and bear the weight of the upper body. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.